New data shows fewer than half of Colorado mothers breastfeed their babies during the first year of their lives. KRDO News Channel 13's Andrea Herrera is live in the newsroom to explain what experts and mothers believe is behind this decline. Andrea.
Bart, according to the Center for Disease Control and Prevention, only 43% of mothers continue with this journey. And Colorado breastfeeding experts believe that the figure could be low due to the lack of information mothers receive after leaving the hospital. But it's also the barriers working mothers could face that could be contributing to this decline, too. Becoming a mom in the first place is not an easy task, and in today's society, several moms have a different mindset.
I think in today's modern society, moms are more, moms are not in the house as much as they used to be. They have jobs, they go to school. Not every mom is sitting at home or being a stay-at-home wife.
Michelle Howard is a mom of two living in Colorado Springs.
Those first few months, yes, you might be, if you're lucky, like I was, to get maternity leave, you have the time to pump or breastfeed.
But not every mother has that. The Center for Disease Control says breastfeeding a baby prevents sudden infant death, respiratory, and ear infections. The CDC estimates that fewer than 50% of mothers continue nursing through the baby's first year.
A mom might start breastfeeding, things might be going well in the hospital, and then she's discharged. And after that point of time, she doesn't necessarily know where to find the advanced lactation support that she really might need.
Stacy Miller with the Colorado Department of Public Health says that the decrease in number of moms breastfeeding across the state could be due to misinformation or medical support.
It's usually because they didn't get the support they needed early on in their breastfeeding journey, and then it forced them to have to feed their babies infant formula, even if that wasn't their feeding goal to begin with.
In Colorado, there are a lot of free resources that help provide moms and their families with nursing guidance. Two of those being the Colorado Breastfeeding Coalition and the Women, Infants, and Child Care Program, also known as WIC. Both groups help low-income families.
That's another free resource, and often in some of our rural communities, it's often the only major breastfeeding resource in the community.
Although breastfeeding may not be an option for every mother, experts do recommend moms reach out to their healthcare providers about these free programs. Reporting in the newsroom, Andrea Herrera, KRDO News Channel 13.